questions that patients ask all the time is, what are the possible complications? So obviously, overall, the complications are very low after breast lift and breast augmentation, but we need to discuss any type of possibilities prior to the surgery. So I'm going to go over them, but majority of times we give the patient some written documentations, and they can read that material, which go over the possibility of complications. The first and general complications that involve with these two surgeries is infection, bleeding, hematoma, seroma, and wound dehiscence. So risk of infection is very low, but obviously when we perform this operation, we follow the very precise 14-point plan for placing the implant, and that will decrease the risk of infection. But the infection is one of the problems can happen. Bleeding and hematoma, which is accumulation of the blood in the underneath the breast, which usually patients present with extreme enlargement and bruised breast with significant pain, and needs to be addressed very quickly. Seroma is a fluid that develops around the breast implant or inside the breast cavity that we create at the pocket, and that sometimes needs to be drained. Wound dehiscence is sometimes the implant is too big, or because of the pressure, the wound falls apart, and they will have a gap in that area, and that's one of the possible complications. People can experience some temporary or permanent skin numbness or nipple numbness, and that's one of the problems that can occur after the operation. Cardiopulmonary, deep venous thrombosis, and pulmonary emboli, those are the very uncommon problems. That's why we go over the patient's medical history and perform the appropriate test prior to the surgery to minimize those issues. But obviously, every time you go under anesthesia, there are possibility of developing blood clots and developing heart attack or stroke or pulmonary emboli. Normally, these are higher in a longer operation in older patients with medical problems, but younger patients, the ones that they go under breast augmentation, which is a very fast and quick surgery, usually have a very, very low possibility of that problem. The other issues that is very, very common, obviously, after the surgery is lack of meeting the expectation of the patient. So a lot of people coming in say, oh, this size is not the size that I wanted prior to surgery. That's why it's very critical to have a very appropriate expectation prior to the surgery. Go over the very exact measurements with the patient and come up with the range of the sizes that we are able to offer the patient, because obviously the footprint of the breast dictates what size we can place safely for the patient. And patients should understand that. And what I do in the operating room is after I had conversations with the patient before the surgery, we come up with a range of sizes, and then I use the sizer in the operating room and see how good the breast implant look like prior to actually placing the actual implant for the patient. So, overall, that's one of the issues that patient may have. The asymmetry can happen. Majority of patients have a natural asymmetry into the breast, and I always tell them there are certain things that we do to compromise and actually fix that asymmetry prior to the surgery, but there's almost impossible to have two breasts exactly the same after placing the breast implant. So there will be a little bit changes in asymmetry, which is again very natural, and a lot of patients have that expectations prior to the surgery. There are some long-term complications that we go over with the patient. One of them is the the capsular contraction, which there's a capsule creates around the breast implants, and sometimes that capsule contracts and creates a deformity of the breast and associated with the pain, and that can have a very long series of treatments, and eventually, if it's extremely worse, sometimes patients require to have a revision and replacing the implant and removing the capsule. Bottoming out of the breast implant is also a possibility. Sometimes the breast implant size is too big, or a patient does extra activity that they're not supposed to do during that time of recovery, or the breast tissue and the skin is very thin, and the weight of the implant creates this bottoming of the breast, and sometimes it's asymmetric or sometimes it's bilateral that needs to be addressed. Double bubble is another problem that presents in some of the patients. It's not very common, but it can, especially for people who had a very restricted breast footprint, and we had to open them up, and sometimes they can develop this problem. Rippling is another problem that can happen sometimes medially, especially in the cleavage area, and that issue, normally we don't see that with the silicone implant, but that's another possibility, especially more common with the saline implant. The asymmetry of the breast is another issue that can happen after a long time of recovery. Sometimes one breast is different when the swelling go away with the other one. Symastia is when sometimes, again, the size of implants, and if a surgeon violates through the normal cleavage, in order to have a very narrow cleavage, then the breast can attach to each other, both implants can attach to each other or very close to each other, and create a very unsightly complications for the patients that needs to be fixed. Rupture of the implant, we usually don't see that with a new cohesive type of silicone implant, but with the saline implants is common, and the breast can completely deflate because of the lack of inflation after the rupture. ALCL, or anaplastic large cell lymphoma, is a very rare type of lymphoma that is being associated with the breast implants, and some of the breast implants, especially the ones that are rough surface, and they have a higher risk of developing this problem. In my practice, we do the smooth implant. That ALCL has not been reported with that type of implant. But regardless, this is a condition that we discuss with the patient. It's extremely rare, but patient needs to be aware of that prior to surgery. So I hope this video was helpful. If you like my video, please like the video, and also you can subscribe to my YouTube channel and look at a variety of videos that I have for different subjects and procedures that I do. And if you need further information about breast augmentation or breast lift, please contact my office for free consultations at 949-646-8444.